Good afternoon, members of the media assembled here with us. Good afternoon to members of the national viewing and listening population. Once again, I'm with you to bring you up to date on where we at in our fight against the COVID-19 and also to indicate to you what decisions we are taking along this pathway of response. I want to begin today by saying that we won't be assembling like this again for a long time. By long time, I mean during the period of the emergency, because we are being advised that as we move to minimization of exposure, that the live arrangements would be replaced by an electronic arrangement. So we will continue to communicate with the population on a daily basis, led by the Ministry of Health and to a lesser extent by National Security. Those two ministries will be with you on a daily basis. I, as Prime Minister, will be with you very frequently, and you will still be able to ask your questions, but the arrangements will be made for it to be done by the technological arrangements that the Ministry of Communication will be putting in place. And so we won't meet in here as frequently as we do. I understand that the Ministry of Communications will publish those arrangements very soon. Ladies and gentlemen, fellow citizens of Trinidad and Tobago, we have been for quite some time responding to this global challenge. That's why it's called a pandemic. This is not an ordinary situation. When I started interacting with the national community from this podium, I made it very clear that we are in a crisis and this is an emergency station. So it is not necessary for anyone to advise us that this ought not to be taken slightly, because this is not the government that you know that would be unwilling or unavailable to take the firm actions that are required as long as those actions are deemed to be in the best interest of all the people of Trinidad and Tobago. We started out, after significant assessment, taking the approach that will bring the population on board by telling you what the situation is and sharing all the facts with you. Because there are three facts that we have to focus on. One, there's a virus that spreads easily from person to person. And that is why we took the approach of trying to get every person in this country aware of and involved in the response. This virus has been shown in other countries to have the ability to very quickly overwhelm the best health system. As a matter of fact, the position now is that no health system is so good that this virus cannot overwhelm it. So there's a threat to every health system, regardless of the nature of that health system. And thirdly, the way the population is best able to respond to it is by individuals separating themselves from other individuals. Those are the three things that we wanted the country to understand. And that is why we have deemed it an emergency. That is why we have been focusing on the ability of our national health system and our health caregivers to be our first responders, and our strength in terms of responding and having what it takes to respond. And of course, we started out saying the response is do not congregate. Initially we said in groups of 25, then now we say in group of 10, and of course we want to go even lower than that. At home, in the street, at the workplace, do not congregate separate. Those are the three main components of this period of challenge. So we have had some actions taken, and there have been some serious reactions. Let's put that in perspective. We said to you early on that we will take certain actions. We are cognizant that those actions will have knock-on effects, largely negative. And we also said to you that the government, within its limited means, will take action to bring some relief, especially to those who are least able to look after themselves. And that is what the Minister of Finance has done, and it is being done at a tremendous cost. And that cost has to be seen in the context of the country's ability to fund that kind of relief. The Minister of Finance and the Minister of Social Development and Family Services, they are now handling much more resources than were ever allocated. And we have said to you that the national budget has pretty much imploded, and in fact we are aiming to find the resources to do these things, and they will have serious consequences on our ability to continue doing what we were doing before, which is to manage against a pre-described budget, and that budget is now not satisfactory, not sufficient to be effective response. So we are now at a stage where we have had to report, the Minister of Health reported this morning, I think it was, our first death. So we moved from, last night, we moved from not having any instance of reporting of the virus in our country to confirmation that we had the virus in the country being brought in from persons who travel abroad, to persons who had to be quarantined and tested. Having done that, those tests have shown that many of such persons have in fact been infected. We've taken the action to isolate such persons. And of course, as happens with this virus, death occurs. And in our case, we've had our first death. I want today to extend my deepest condolences and sympathy to the family and the community. And of course, as a nation, this singular death is a marker for all of us, because we are all exposed together. And it is a kind of assignment where our individual behavior might be very good, but we are relying very heavily on the behavior of other individuals. And that is why it's irresponsible conduct of individuals expose all of us, and you know what those stories are like. Because today, our circumstance is put in very good order by one national newspaper that in the editorial calls for an immediate locking down of the country. And of course, all the other stories in the same paper is about the effects and the hardships that are consequent upon even the limited restrictions that we have placed. Because initially, we placed some restrictions, particularly on some known sectors, to affect this lack of congregation, to bring about some element of separation. We selected obvious areas of these kinds of activities and ordered them shut under the laws of Trinidad and Tobago. Initially, we indicated immediately that this is what you should do. Most people complied. There were those who were not complying. We went to the parliament, we changed the law, we have the regulations in place. And of course, as we now are being affected in the way that we are being, which is along the pathway, this is a long journey we have to travel. The last time I met with you, I told you I am nervous about the next 2 weeks, because every day is a changed situation. And when we look at what's happening with other people, it could even be a frightening situation. We are saying that the way we're dealing with it is that we're not panicking, we are standing up to it, we are using our strengths, cognizant of our weaknesses, and we are relying on the advice of our experts, our health caregivers, our virologists, our public health officials, the regional agency CAFA, and all the staff who are now required to advise and support the government in guiding the population to a safe place in this fight against this virus. So we've been taking our advice. So it's not necessary for, you know, I shouldn't say it's not necessary. We are not responding to the public relation call or the political call to do this now or do that now. We will maintain our course. We will maintain our reliance on the advice of our healthcare givers, who, on the basis of scientific analysis, will tell us where we are and what is the best action that is required at this time for being ahead of what is in front of us. That is how this government is making its decision from day one. So today, I want to indicate to you, we did something a while ago in order to minimize our exposure to the virus coming into us. We had stopped non-nationals from coming to us. For a period of time, we allowed nationals to come in, and of course then we closed our borders. The closing of a border is the last of how we could separate ourselves from the rest of the world, an infected world. The numbers are growing so exponentially in some of our neighboring territories that the closing of the border is a tool available to us, the objective being that we are shutting ourselves off from the rest of the world. In doing so, there are certain consequences. And one of those consequences is that we have nationals outside who may be on the outside of the fence. And it is easy to make a case for every single one. But if we are responding against the background of all that I've just said, when we close the border, it is not that we're closing it to John and Mary and it's open to Partap and Henry. It will only be useful in this fight if we are able to close it and close it effectively. Let me come to the Barbados situation in a minute. But let me advise the national community that in responding to this virus, the government has not been taking decisions based on what is in front of our nose. We had to look at the wider field and what could come to us from the world. We have 330,000 people outside of Trinidad and Tobago, outside of these islands, who are carrying our passports and who are claiming to be Trinidad and Tobago citizens. 330,000. That is a quarter of our population. A quarter of Trinidad and Tobago's claimants to these islands are outside in other countries, many of whom are living there, most of them literally migrants. But the bottom line is, in this situation, they have to be taken into account in the equation. If we have decided that the thing to do here in Trinidad and Tobago to protect this 1.4 million, we have to close the border. We were asked, I think from this very podium, I think a member of the media did ask me because I answered the question, does it mean, or are you also closing it for CARICOM nations? And my answer was yes, because we had thought it through. If we say we have closed our border, shut down our airport, not allowing traffic into us for the reasons best known to you by now, and any other CARICOM country keeps the airport open, and any of these 330,000 or any other person coming to that territory on that basis have access to Trinidad and Tobago, may I ask you, is our border closed? We had a situation subsequent to the closure of our border where some nationals embarked a flight that could take them only to Barbados, because the border in Trinidad and Tobago was closed. And persons on that flight had two options. One, when they got to Barbados, the authorities in Barbados had the authority to send them back to where they came from, because we as a country had declared our border closed. However, in communication with that government, Attorney General, Prime Minister, in communication, we ended up with the arrangement that those persons having landed in Barbados will be subjected to the Barbados authorities. Their arrangement there was mandatory quarantine. Nobody is stranded and left in the street. Mandatory quarantine in Barbados under their laws. And of course, when you go into mandatory quarantine, in the protocols of WHO, you only come out after a certain condition is met. And that condition is not to call up irresponsible politicians in Trinidad and Tobago who then start to make hasikara to demand that all the plans that we have put in place should be disregarded because somebody sees an opportunity to get in on the act. This government will take reasonable actions, and the reasonable action we have taken is to know that our people in Barbados are in quarantine. At the end of the quarantine period, they'll be tested there. And when they reach the WHO standard to be released, if they make their way to Trinidad and Tobago, they will arrive here and then be subject to the CMO in Trinidad and Tobago. Why is that so difficult to understand? This particular situation was the subject of conversation between the prime ministers and attorney generals of these two territories. And I will say here today, stressed as we are, that the opposition leader going behind the government back to the government of Barbados against statements that this country has made its citizens stateless is yet another example of the opposition in Trinidad and Tobago not prepared to be responsible in this case in a period of crisis, but seeking to score political points. Because I could tell you, we don't have to wait until the opposition leader thanked the Prime Minister in Barbados for treating with the people of Trinidad and Tobago. We didn't tell you this, but we gave, I better not say it. Let me just say it this way. The relationship between the government of Trinidad and Tobago and the government of Barbados is all about brotherly and sisterly love. It is embarrassing to always have to talk about this kind of behavior, especially when we're talking here about further actions for separation against the background of the other voices saying, open the bars, open the windows because of consequences ABCD. These actions that we are taking will have consequences, and the consequences are not pleasant, but they are the best arrangement for saving lives. That has been our conversation, and it will continue to be our conversation. We are not here talking about temporary or momentarily being inconvenienced. We're talking here about saving lives. And if that is not important enough to some people, then just leave us alone. And we'll fight this fight alone if we have to. But in the meantime, we will enforce the laws of Trinidad and Tobago. And more enforcement will take place. Because we expect more and more people to be misled. Because you see, if people are led to believe that the government's position is one of deception, so you can't wait until the official protocol of the announcement of a death takes place, because you are led to believe that the government is hiding that fact. We're not hiding that fact. We're just behaving decently so that the family could be advised before it becomes a political football. Is that too much to ask? Today, I want to advise the national population that over and above all that has been said, the Minister of Finance has been able today at the Cabinet's instruction to make an additional $157 million available to the Ministry of Health as part of our further preparation to build further capacity, particularly in the RHAs outside of the NCRHA, which have not so far been identified as having the capacity to be a responding entity. So far, we focus on the NCRHA because they have CORA in there and CUVA in there. That's that unit. But if the worst comes to the worst, as it could, because I kept saying, and you all know, it is quite possible, because no guarantees could be had, that it doesn't get terrible. We are doing things to stave that off, but we can give you no guarantee. But we are preparing to be in the best position to respond. So this additional expenditure to build more capacity, we are building that capacity as we are acknowledging that so far, so good. And those who are involved in this will do their job, because today, Trinidad and Tobago expects that everyone will do his or her duty. But because I want you to understand, we are reporting, the Ministry of Health will in a little while report our numbers, where we're at. But just remember that we had an unusual development on that scale of numbers. And in planning, as we model the outcome of what we could be facing, we take the numbers in a particular way, and we take the advice of the experts who do that. And in the very near future, we'll have some more modeling done. But we are now sufficiently convinced that we are at the stage for further enforcement. Further enforcement. Because this is all about doing what has to be done ahead of the curve. I've asked my cabinet colleagues who have agreed that the cabinet will instruct, and that instruction is not a request without the muscle of the law. The Attorney General and others will tell you which laws are going to be enforced. Minister of National Security and his security teams. The Commissioner of Police and his men and women are standing by to enforce the quarantine law, and all the others. We need this. We are at the stage now where joke is joke, but this ain't no joke. Those people in this country who figure this is a joke, this is about life and death, and your foolishness will not be tolerated. Your responsibility is required and will be extracted. You would have seen the kinds of costs associated with the limited action that we've taken so far. And the further action that we are going to take will have similar kinds of consequences in terms of inconvenience and costs. And also, don't forget that we don't know how long this thing is going to last. We have to factor that into it as well. And we're doing the best we can with what we know and what we have. But the virus demands that we do more. So I'm announcing here today that from Sunday night, midnight on Sunday night, we will deepen our separation by having non-essential activities forbidden. Any activity which can be deemed to be non-essential, and the Minister of National Security and the Minister of Health by tomorrow will put a list out there of what is deemed to be essential. Because you see, when you say lock down the country, meaning that you just shut it down, the country is not a light bulb where you just flick a switch and you lock it down. Every single person who is engaged in the health sector, not just the Ministry of Health, the health sector is required to be on station. The health sector. So the state workers need to go to work. Private sector workers need to go to work to keep the health sector, because if there is no health sector, if you lock down the health center and lock it out, well, we throw up the white flag to the virus. But we are fighting. The white flag stays down. We are fighting. So the health sector has to stay up. We also have taken steps to provide support in the social sector. Our arrangements for various institutions have to stay in place. The social sector and other institutions have to stay in place to respond. Because if we shut down the social sector, who is going to provide the social support? Who is going to run the social support system for those people who are relying on the social support system? So you can't lock that down. You can't shut that down. As a matter of fact, you have to ramp that up. The Minister of Social Development has just confirmed that her ministry is taking steps to move OJTs into that ministry to help in the management of what we have taken on, which was not the normal workload of the ministry. And all that has to be done with dispatch. The utilities have to stay functioning. Whether it's T&TEC to keep our power on, whether it's WASA to keep our water on, TSTT to keep our communication on. 3 essentials. They have to stay on board. And not only stay on board, they may even have to do extra. Because this situation is calling for all of us to walk that extra mile. So the utilities have to stay on board. The health sector, delivery and supplies from the private sector, they have to stay. They have to be on board. And of course, we've shut down and denied access for entry to aircraft into our country, unless they're authorized by exception. The airport has to stay open. Our seaport has to stay open because our food has to come in by air and by sea. So cargo has to come in. And therefore, the customs department have to be at work still. Right? Immigration has to be there. So there's a huge chunk of the country that still has to function as a response to the virus. So this locking down of the country, which is a fashion statement, might be a fashion statement for some who want to get in on the act. But for the government, we're not dealing with a fashion statement. We are dealing with well thought out, well organized responses, understanding that some people are required to be out and some are required to be in. Those who are required to be out will be deemed to be the essentials. We still have to produce. The private sector is required to produce to feed us, so the food and market sector has to be out there. We're going to categorize it in such a way that we identify a large block of the population that is not essential. And if you're not essential, from Sunday night, stay home. And if you're going out, it's part of the essential arrangement, essential to get food, essential to get medicine, pharmacies will be open, and so on. So it's essential versus non-essential. You see the liming and the congregating, the police will enforce the law. You see the lack of common sense or they don't give a damn, the police will enforce the law with the full support of the defense force. So expect that. We're telling you that today. It comes into effect on Sunday night. There's no need to overrush. We know that you'll move to make arrangements because you know what is coming. If you have to go out to work, to do these things in the essential sector, you make the arrangements. And of course, if you have children, you make the arrangements. We're pretty close to the Easter holidays. You would have to make the arrangements anyway. We're bringing that forward. If you don't have any business out there other than just congregating, liming, or just trying to give trouble, we will respond. I simply want to appeal to every citizen not to be a problem by causing the police to have to act against you. Be a responsible citizen. Your first duty is not to be recognized as somebody who is not cooperating with these requests and instructions, because this is the only sensible response in our fight to save lives in Trinidad and Tobago. So we have these people in Barbados. We'll wait until the quarantine is over. And in the meantime, we'll continue to talk to our colleagues over there. I understand that there were some more people in Suriname who the Minister of National Security had not prevented from coming in. They had problems getting a crew to fly the plane. So there are these things. So I simply make these points so that you will know that a lot of what you are told in isolation is not the whole story. And I also want to say that of all that is involved here, the government is the only entity that has the responsibility across the board for all the people of Trinidad and Tobago. Sectoral interests, individual interests, or even opportunity for personal gain. The government doesn't have that as part of its mandate or its expectation. Minister of Health, you have the floor.
Thank you very much, Honorable Prime Minister, Cabinet colleagues, ladies and gentlemen of the media, wider listening and viewing public. My task here this afternoon is to give you an update on where we are with COVID-19 and where we are going as far as RHA preparations are concerned. As the 10 a.m. bulletin would have said, we have to date sent 407 samples to CARFA. Of those 407 samples, 61 have tested positive. It must be noted that out of that 61, 44 are from one source, that is the cruise ship. Whether they were part of the original 68 that came in, or the 2 or 3, I believe, that came in before. But 44 are from the cruise ship. To date, unfortunately, and I offer my condolences personally again, we have had 1 death. So those are the numbers as we stand now. The Honorable Prime Minister would have told you about $157 million allocated to fight COVID. I will now give you some details on how that money is to be used across the RHA sector. So the general headings that this $157 million will be used fall under consumables. That is things like gloves, surgical caps, swab kits, syringes, and so on. The other second heading will be our human resource capacity. We have to ramp up our human resource capacity. So consultants, house officers, enrolled nursing assistants, and so on. The third category of spend will be under infrastructure. So across the RHA system, we may be building more things like isolation rooms, self-quarantine area for staff, and so on. And then the fourth and final category will be equipment. That will be things like cardiac monitors, ventilators, vital sign monitors, and so on. How is this broken up across the 4 RHAs? Eastern will be getting $6.2 million to ramp up their capacity, which will include the expenditure they are incurring at Balandra, because that is not a free service. That particular facility is costing us about $85,000 a month, where we had put in the $85,000, where we had put in those 68 citizens who came in from the cruise. The Northwest RHA, same categories again. They will be allocated $16.6 million, again, to ramp up their response. The Southwest Regional Health Authority, they will be getting $4.5 million under the same headings to ramp up their response. I will tell you, as of yesterday, the same instruction I gave UDCOT to reprogram works for Arima Hospital, which is now ready in case we need it. We are doing the same thing with the Point Fortin Hospital. So in case we have to use the Point Fortin Hospital for COVID-19, that will be up and running just as a primary care facility in the not too distant future. The rest of the funding, the lion's share of it, goes to NCRHA, because at NCRHA, that is the focal point for the COVID-19 response. They are in charge of the Cora Health Facility, where I gave you figures at a previous press conference. They are now up to 100 plus beds, and Couva. They will be receiving $129.9 million to ramp up. So That gives you a total of $157 million that will be allocated over the next 3 to 6 months.
It's TRG.
Sorry?
TRG.
No, TRG will be handled separately. So this will be done over the next 3 to 6 months. This, folks, is going to be a marathon. So this initial injection is not the final sums. However, things like infrastructure will be, and equipment will be a one-time cost. The incremental cost, the variable cost that will change with time will be consumables, because the longer this goes on, the more consumables you will use, and HR. So I have been given the order by the cabinet that if and when we need more funding, especially for the variable expenses like consumables and HR, I will come back in. But this is going to be a marathon. This is going to cover us for the first few miles of that marathon. And we will come back to the cabinet if and when circumstances dictate that we need increased funding. Two more minor points, but not minor. With me today, I have the Chief Medical Officer, whom you all know, no introduction. But we also have a new expert who has been working with us quietly behind the scenes. This is Dr. Marlon Rampol, infectious control disease specialist. He works at Cora, and he works with Dr. Michelle Trotman, I believe, correct? He is here to answer your questions on how we manage infection control. The last item on my agenda to speak to you about is the People's Republic of China yesterday donated some equipment to us at a very simple ceremony at the Ministry of National Security. It was not a media event, it was just a simple handover. There seems to have been some mix-up in the figures that found its way into the public domain. I just want to correct it now. The People's Republic of China, as a friend to Trinidad and Tobago, kindly donated 15 thermal scanners, not 1,500 as being reported. We honestly don't have need for 1,500, but we do have a need of 15. And they will be deployed at our various ports, airports, by the Minister of National Security. We also received 4,000 test kits to test COVID-19, which will be handed over to CARFA. Following that, I have also written to His Excellency Son Heung-min for Trinidad and Tobago to purchase a further 15,000 test kits. To purchase. That will not be a gift. That is for us to purchase. In addition, we are receiving more and more test kits, literally on a weekly, sometimes bi-weekly basis, from PAHO, other agencies. So we're in a very good place right now with test kits. So that is my report to you, very short, to show you that the government is in fact pumping resources into this COVID-19 response. So far, the RHAs have been spending their monies from their budgetary allocation. So this will be replacing what they have spent from their budgetary allocation, but this now gives them the financial headroom to ramp up their responses at the various RHAs, but the lion's share goes to North Central. So that is my report for you today. We have the Chief Medical Officer here and Dr. Rampol, who might want to come up and tell you briefly what we are doing as far as infectious disease control is concerned.
Thank you, Minister. While Dr. Rampol makes his way to the podium, I want to clarify what I just said to make sure that is not misunderstood. Come Sunday night, we are increasing our separation. We are asking people to stay at home under the existing legal arrangements. Is not a state of emergency. We are not declaring a state of emergency. There are laws and regulations in place now that can cause our security services to enforce no gathering and to enforce the kinds of separation that we are asking for. It is not a state of emergency. I described it as essentials being able to come out, non-essentials we expect to stay home, right? So you will be told tomorrow what we regard as essentials and the entities, and there'll be a comprehensive list. And this arrangement that I'm now announcing goes until the 15th of April. Initially, we had spoken about schools in the context of the 20th of April. With this stay at home from Sunday night is until the 15th of April. Long before then, we'll be in a position to assess what this means and how it is working, to be able to adjust as we may have to adjust as we get nearer those dates. Right? Thank you very much. Dr. Rampol, you have the floor.
Thank you, Honorable Prime Minister, Honorable Minister of Health, other Honorable Ministers here. Thank you for this opportunity to speak today. So as the Honorable Minister of Health mentioned, I am part of the National COVID-19 Steering Committee that also includes Dr. Michelle Trotman and another essential member, Dr. Don Antonio Martin. We have all been actively involved and engaged with the Minister in terms of our approach to this COVID-19 crisis. So what I would like to start by saying is that COVID-19 is a very challenging disease from the standpoint of the medical community, the healthcare community, and the global community at large. It is constantly evolving, and therefore we need to constantly evolve our policies and practices as new information comes to light, and we have been doing so. One thing that has not changed and has been constant and has been well established is the importance of behavioral changes at the public level in order to help us curb and mitigate the spread of this disease. And it cannot be reiterated or re-emphasized enough the importance of measures such as social distancing, which simply means avoiding gathering in large crowds, mass gatherings, the importance of hand hygiene, avoiding touching your face. It may seem as though it's something simple and something being said over and over again, but I cannot stress how important it is. It is a simple and very effective measure that could significantly help us mitigate the spread of this disease. And of course, the other component of this is cough etiquette, which means coughing into your elbow or into tissue and discarding it. Earlier today, I engaged in a video conference with doctors and other representatives from China, and it was an extremely useful sharing of information. The information gleaned there will be incorporated into our current policies. What I would like to say is that the measures that are being taken at a national level in terms of closure of schools, closure of borders, and now the additional step to allow for the non-essential workforce to stay at home, these are very essential measures in that it gives us as a medical community the opportunity to try to mitigate spread of the disease. What we are doing in this time is actively investigating for any evidence of community spread. It's very essential that we identify this so we can take the necessary precautions. The other point I wanted to stress upon is what can you do apart from the measures that I mentioned. One thing that has been asked a lot is the need for wearing surgical face masks. And I would say that at a public level, surgical face masks are not necessary. All that needs to be done is strict enforcement of hand hygiene. And the wearing of these surgical face masks actually takes away the availability for the medical professionals who would actually need to use them. So they're laughing because we have some members here who are actually wearing face masks right now. Go ahead. Okay. So the other thing that the Honorable Prime Minister touched upon is the importance of a coordinated national response across the RHAs. Right now, the NCRHA has been highlighted as the the initial component of the COVID-19 response, in that the Cora and the Cuba facilities fall under the domains of the NCRHA. However, we have to look at what's happening at the global level and learn from this. We see situations where entire healthcare systems are collapsing. So we need to make sure that measures are in place across all of the RHAs, so everyone would be equipped to deal with this should it escalate to that level. We hope that it won't, but measures have to be taken in place so that we are ready to deal with it should that happen. And what I would like to say is that even though all of the members of the COVID-19 committee are stationed under the NCRHA, we would be available across RHAs to disseminate the protocols that we have now and to assist the other RHAs with development of protocols of their own. I have already been in contact with representatives from the ERHA, NWRHA, and I have actively been engaged with Dr. Stanley Giddings, who is another infectious disease specialist attached to the SWRHA. I think that it is extremely important that even though we have RHAs, we have to understand that this has to be a unified, coordinated national response moving forward. I think that would be the main things I wanted to highlight here today.
Thank you very much. Thank you very much, Dr. Rampol, for your very enlightening presentation. I am now asking Minister, you, Dr. Parasam.
Dr. Parasam.
Dr. Parasam. Okay, Dr. Parasam was well represented by Dr. Rampol, and thank you very much. Express our thanks to the team, and we are counting on their continued involvement in the international community. I'm very pleased to hear that the offer that was made to interact with the Chinese medical fraternity, and because in dealing with the science, the best data available now is from that location where they have experienced what we have not experienced and hopefully will not experience if things go well for us here in Trinidad and Tobago. That contact is very valuable for our technical people, because sometimes very simple things can have far-reaching positive or negative consequences. Minister of Social Development, could you take the mic now and indicate where you're at with your assignments?
Thank you very much, Prime Minister, colleague ministers, members of the media, the listening and viewing audience. I would just like to give an update with regard to where the Ministry of Social Development is with regard to the issues that have been presented to us to execute for the people of Trinidad and Tobago through the government of Trinidad and Tobago. I would like to first indicate that in all the social development offices throughout Trinidad and Tobago, we have now placed customer service representatives whose job is to deal with those persons who have been affected by the events that are taking place in the country right now. And those are those who have been terminated, those who have been retrenched, and those whose salaries are now reduced. So the customer service representatives will deal only with those people. And right now, we have 10 offices in Trinidad. We have 1 in Tobago. So we have 11 persons who have been recruited for this purpose, but we will be increasing the number so that we can deal very swiftly with the people who come in and also give them the support that they need. All the guidelines are now on the ministry's website. All forms to be filled out are also on the ministry's website. We have also asked the Ministry of Labor to put the forms and guidelines on their websites, and we have asked every ministry to do the same, so that these forms and guidelines are now on the Ministry of Social Development and Family Services website, the Ministry of Labor's website, and all other ministries will have them on their website, so everybody can have access to the forms and guidelines. But I'd like to make the point clear that if you come into the office, we will also have forms and guidelines there, so the customer service representatives will help persons who are in this position to fill out the forms and understand the guidelines. With regard to elderly homes, we had a concern raised with us that persons were still visiting elderly homes. So in an effort to ensure that the elderly are protected, those who are in the homes, we have reduced the number of visitors, and we will eventually stop visiting to those homes for a period of time in conjunction with the Ministry of Health giving us the proper guidelines. So that situation is also, there was also a concern that the subventions would not be presented. We now give subventions to 7 homes. They will all receive their subventions, so please, you do not have to be worried. Every home that now receives a subvention will get their subventions. We also have care centers for the elderly. They will also receive their subventions. I'd like to assure you that the call center is also operating, and people can call into these centers and receive advice from the call centers. I'll repeat the numbers. The numbers are 800-1673, 800-1673, and 753-2273. On that second number, you can send a WhatsApp message, and it will be responded to immediately. I also want to take this opportunity to indicate that the expenditure that is being put out for these services on a normal basis, for the persons who receive a disability grant, they get a total of $49 million per month is spent by the government of Trinidad and Tobago. For those who receive the public assistance grant, $28 million per month is spent. For those who receive the senior citizens pension, the government of Trinidad and Tobago now spends $338 million per month. And I'd like to reiterate that we will be improving or adding to the amount that is now given to those who receive the disability grant and those who receive the public assistance grant to help you through this situation. Those of you who are on the reduced income or who have been terminated, you can come into the offices of the Social Welfare Division, and your information will be taken, and our objective is to ensure that we expedite your payments. So, ladies and gentlemen, these are the updates that I can give at this time. And if there are any questions, I'm sure when question time comes, you can ask. Thank you very much, Prime Minister. Thank you very much.
Thank you very much, Minister Robertson Regis of Social Development and Family Services. I want once again to reiterate what I just said, because it wouldn't be Trinidad and Tobago if it doesn't go like this. First, we were anxious for our first viral arrival. So you got all this information, the virus is here, the virus is here. It eventually came. Then after that, they were anxious for the first death. The town crier went out and had the announcement of the first death. Now we are anxious for a state of emergency. We have not declared a state of emergency or any lockdown or any whatever SOE, whatever you call it. What I have announced is an upgrade of the stay at home. We had a stay at home before, which said if you're sick, stay away. That was in the beginning. We've gone further now. We are saying that if you are deemed to be not part of the essential operations of the country, as of Sunday night, you stay at home until the 15th of April. What we are doing here is another kind of sick. Sick is now spelled in two ways. The first order to stay home is if you were genuinely SICK. Now, if you are SIQ, you stay home now, which means separate, isolate, and quarantine. So if you are not part of the essentials of the country's operations, stay at home. You come out only for essential activity. If we are able to be as disciplined on this and in this situation as we were as disciplined in Panorama with the steel bands, we will succeed. We can be disciplined. Just cast your mind back to the stage in the savannah at Panorama, and you ask yourself, who are these people who could be so disciplined to turn up to practice every night, to not be able to read music, but to carry with them in their heads, to be played without a sheet, complicated music, and change it during the Panorama competition and make magnificent music. These are the same people who now can't be disciplined to save lives. I believe that we can. Question time. And again, what we do, we don't want to keep you too long, so we'll give each person a maximum of 2 questions if you have 2 questions. We're not going to conduct the long interviews that we normally do. So Rhea, you start. You don't look pleased with 2. Let's hear. Go ahead. Because some of your colleagues were complaining that we were keeping you all too long and so on. The government is being accused of giving too much information. So let's see how we go. Let's start with Rhea. Dr. Rampol? Yes. Or Dr. Rampol? Well, Dr. Rampol, if she... Come. Well, okay, you have the minister up here already. Okay, well, put the question and either Dr. Rampol or Minister Terrell will answer. Dr. Rampol is the doctor, right?
That all the cases are travel related. But the person who died yesterday, the information is that the person came into the country.
Okay, if that is the question, I think Dr. Parasham would like to take that question.
Okay, I thought Dr. Rampol, as an infectious disease expert, might have had. Okay. So the information is that he came into the country on February 5th, and he presented with symptoms on March the 13th, which is 5 weeks later. So that appears to give the lie to the theory that we didn't have any domestic.
Sure. So first of all, the information that you have, you should not have had in the first place. The information you got is circulating from someone's private notes that was sent out through Facebook. It's a breach in patient confidentiality. I have already spoken to the CEO to find out how that breach occurred. It should not be out in the public domain. It's too much information, one. All the cases that we have, I would have gotten information from the doctors that actually saw the patients. So Dr. Rampol is the infectious disease specialist at Eric Williams. He doesn't have the information for the first patient. He doesn't have the information for this patient either. And he shouldn't. So that is actually from the notes. We have said something is imported or not based on the notes from the actual doctor that saw them. I don't know what this is that is circulating. I haven't looked at that in detail. But in the first instance, we have asked our physicians to say whether it was imported or not from whichever hospital it occurred in the country, Tobago included, and they have given us that guidance from the first instance. So we are basing our imported or not imported, or even something called, there's beyond imported and between imported and community, there's another category, which is just going into epidemiological terms. But the doctors that actually see the case makes that determination, sends it to the lab, and the lab generates that to us. Okay, and that's how we make our determination.
What you've said hasn't really...
I understand what you're saying, but as I say, we have to look, based on the information that is circulating around, There are induced cases, there are imported cases, there are a number of terms that we can use epidemiologically. It does not bear well beyond saying that it is an imported case, which is a broad term that encompasses a lot of things. So I don't want to go into the details of an individual patient at this level, but we can discuss it afterwards if you like.
Doctor, for my own edification, could I ask, this 14-day, how definitive is that?
It is not. And I would say clearly that the research out of China even has said that there are outliers in all of this. And as Dr. Rampal has clearly pointed out, there is a new virus. All of us are working with 14 days. We are hoping to God that it is right. There has been shown viremic patients up to 42 days in the research. Some as far as beyond 42 days, documented 21 days. So there are outliers in any viral illness. When we had Zika starting years ago, initially we thought it was a very short incubation period. Then we found out there was transmission as a sexually transmitted infection that could go for months and months and months. So it is a detailed epidemiological look we have for every case, and we have determined whether it is imported or not based on that look. No, I'm not saying we're not certain. I'm saying all the cases that we have listed as imported have come from the physicians and the epidemiologists telling us so in every single case. All right?
All right. The other leg of that question to the minister, what are the procedures, protocols for announcing the death of a patient? And I want to add whether in an unusual or abnormal circumstance, whether obligation.
That's a question to be answered by the politician. Let the public servant answer that question, please. Because politicians don't declare anybody dead.
So let me tell you. Well, I don't know if the death of a patient should be a public interest matter in the first place.
But this will not be the situation because it's not a heart attack he got, it's an infectious disease which is ravaging.
But basically our policy and procedure is that the family, the relatives need to be informed first. And that is key. When this occurred, we would have taken all the necessary steps to communicate with the family. Some of the relatives are abroad, and I don't want to say too much about it to let out information. So it takes us a significant length of time to not only reach out to them, they have to receive the information, we have to be counseled, they also have to bring in certain vital pieces of information to us to confirm the death, for instance, identification, etc., which has to occur prior to us going to the population. Could you imagine if your relative has passed away, we go right ahead, as soon as we get the results, send that out in the press, and then they find out by looking at the press. How would you feel? So we have to ensure that the family are well informed prior to doing anything in the press.
But don't you think you also have the gap between the actual event and the public, the confirmation from the ministry was so wide that
I don't think the gap was wide at all.
But it created a window for the opposition leader and everybody else to get the same information that, I mean, nature abhors a vacuum, and if there's an information vacuum, somebody might fill it that is not the authorized person. So that's all I'm saying.
So I mean, everything is variable. I mean, it depends on how long it takes to contact a relative. Sometimes people die during the night in hospital in normal settings. We can't get a relative until the next morning. So it is very variable. If we can contact somebody and the process and the policy is followed through early enough, we will send out our release based on that. But it has to be guided by relatives are informed and comfortable first before we send anything out.
CMO, Rashad Khan, Guardian Media. Okay, so again, on the point that Ria was making, we know that the patient died around midday, and we had confirmation from close members to the family that the family found out soon after the death. So again, it begs the question, why such a long period of time?
I was in contact with Dr. Trotman. She called me first when she found out as well, and she followed the process. We both followed the process. I don't know how the information would have leaked out, I suppose just like everything else prior to that, but we have to follow our process.
Okay, and so back to your point that you don't think a death is of public interest, but given that the COVID-19 is now as the Prime Minister said just now, a national issue. It's a crisis, and it's has put us in an emergency situation. Wouldn't a death of a patient constitute public interest, therefore?
Any information on the patient must be borne in mind. We need to take it step by step, and we had taken the decision clearly in the early days to report to the population twice a day, which I think is more than adequate in terms of the number of cases tested, the number of cases positive, and as we have had a death, we will continue to do so in that light. So I think it is added another tier to our list, but beyond the twice a day reporting to the population, I don't think we need to go beyond that.
Can we expect to see then in the future an expansion of these criteria on which we get information on? So like you said, we get samples, well now we're getting unfortunately deaths, and we're getting positive tests, but when we look to our neighbors right in Jamaica, we are seeing more detailed information. The public is seeing this and asking why we don't have it. We are seeing information such as the exact amount of people who are in isolation in government facilities, those who are at home, and this kind of information.
Yes,
Can we expect to see that
information from time to time? Every country will determine, based on their peculiar situation, what is relevant, what is not. We are guided by WHO's guidelines as well, and we think that the information we're providing now is sufficient. If, of course, that changes, as it has changed with the death, we add certain parameters on, we will continue to do so if need be.
I want the Prime Minister, this is another leg to the same question. The vacuum.
Let me just say something here. Mike. Yeah, let me just say something here. I have you all in front of me, and I don't intend to spend the other valuable time dealing with the irresponsibility of the opposition leader. Right? Dr. Parasam has said, and that he held his position, there's a protocol for the announcing of persons who are deceased in the health system. That protocol is not to be breached. If there are persons who have access to information before that, that will come up against the protocol. And if there are persons who believe that they want to be the national ghoul or the national tongue crier, let them do that. We have other things to do. Any other question?
But the vacuum caused anxiety among the families of the other patients.
But I'm saying, what caused the anxiety? Is it the tardiness of the health system announcing it, or somebody announcing it politically and prematurely? What caused it? If the normal process was allowed to work, then there would have been no anxiety. We are in a situation where this exposure could result in persons' demise, and if we have to report that somebody has passed, and in fact someone, as the system has said, had pre-existing conditions and so on, a normal, decent arrangement can be made. This role for the politician in there is a role, I could tell you, and maybe I'm alone in this matter, I could tell you, I am very, very concerned about the role for politicians in a particular arrangement. The Ministry of Social Development is currently engaging the political offices to assist in speeding up certain deliveries to the public. That in itself might be a good thing, but it is fraught with all kinds of dangers because we cannot rely entirely, continuously, and consistently on the decency of some politicians. And I say no more on that. Any other question?
Well, Dr. Parasram, please. The patients in Couva and Cora, do we get the demographics in terms of, let's say, gender, age, and so forth?
As I said, I think yesterday, day before yesterday, that we're actually working on compiling the actual demographics to see if there are any trends in that particular group. But so far, as I said, they sort of fit the international trending that has been happening. When you're dealing with research, you look at the bigger numbers. So the international community would have a lot of research done on demography in terms of types of patients affected, types of patients that have severe illness. So we are looking at our cohort of people. My epidemiology unit is looking actively to categorize all of them. And as we get new cases, we're adding it to that list and developing graphs and looking at the criteria from a research perspective to see what is happening in our population, because every population is unique. It's a new virus. We all behave differently. The virus actually behaves differently in different climates, different times of the year. So we are trying to categorize what is happening in Trinidad to see how best we can tailor our response to our unique situation.
Any word on like the condition of everybody in quarantine? Like, are they mild or?
Yes, I would have said. I mean, I can send something in writing to you all, but I would have given that update yesterday.
I just wanted, I had two questions, not necessarily from the doctor.
Who is question two? National Security?
Minister, yes.
National Security.
No, two questions is multiple. Yes, Ria, your second set of two questions.
I have a pre-action protocol. Well, I don't know if it's a pre-action protocol letter or a polite letter, because but I have a letter from Gerald Ramdeen sent to you on behalf of the people in Suriname.
Okay. I was waiting for that to surface. Yesterday evening at about 6:15, the Permanent Secretary of the Ministry of National Security received a letter from an attorney who I believe is in Gerald Ramdeen's chambers, addressed to the Minister of National Security, purporting to act on behalf of one national who is in Suriname. And I think it was about 7 pages. We sent to the Attorney General, the Prime Minister, and so I sought advice from senior counsel and dispatched before 12 o'clock today a response. Basically, what I indicated is that his client had not made an application for an exemption to the closure of the borders to enter, all right? So until you make an application and provide justification for me to consider, there's nothing for me to consider. So I invited Mr. Ramdeen's client to make an application to me to justify why he thought he should be exempted from the border, the closed border. I will, as soon as I receive the information, consult with the Ministry of Health experts that I've been speaking to throughout before we make any decisions, and we will take it from there. But it's premature at this stage. It seems to be.
Thank you very much, Minister. Thank you very much, Minister of National Security. I just want to add, in the vein of what I've been saying about stay at home and being essential, the banking system, the banks, will be required to stay open because they have to service the effort. So, and I've asked the Minister of Finance. The media is always open. Essential and open. But I've asked the Minister of Finance to ask the banking system, given the nature of what we're fighting and the response that we're trying to put in place, that we ask the banks to have the first 2 hours of business advertised as confined to servicing senior citizens. So 8 to 10, senior citizens should be advised to go to the bank early. We want to ask the banks to cooperate by reserving that period for senior citizens, and subsequent to that time, others will be served. And ask the supermarkets to try and operate that kind of system as well, because unfortunately, the senior citizens, many of them have to do banking. Those who are relying on the social services checks, either to go to collect their money or to cash their checks, and so we have to try and facilitate them. And also, you must remember that they're the ones who are most vulnerable to this disease, so and would need to get out and get back in as quickly as possible. So if the operations of the banks and supermarkets can facilitate that as part of our response, that would be very welcome and useful. We're just about to end the question. What's your name, this gentleman?
Rashad Khan, Guardian Media. Well, it's actually for the CMO, if you wouldn't mind. CMO. So yesterday, you indicated that now going forward, stricter measures are going to be taken against those who refuse to quarantine and those who are irresponsible. What are we going to see happen to the local personality who refuse to quarantine or self-isolate themselves and could very well, and has been speculated to be possibly our patient 31?
Yeah, so basically what we had is we had somebody that would have tested positive. There's a number of people that would have traveled recently, come into the country, only tested after you get symptoms. And what we're asking people to do from day one, once you travel recently within the last 14 days, that you should be at home. So I suppose that case that was highlighted in the media shows us what not to do. And that is what we are fighting against. And I think the decisions taken today are really to fight against that one particular case or persons doing exactly the same thing. So what we're trying to do is restrict the movement of persons in Trinidad and Tobago, because after saying many times that people should stay at home, obviously the call has not been heeded. So the restriction of movement of people to essential services, we hope together with the Trinidad and Tobago Police Force and Defense Force assisting us, will do just that now. The Quarantine Act, in terms of someone presenting, when he presented and became positive, whenever somebody presents and becomes positive, they are taken into hospital at present, which is the present protocol, and that will be followed thereafter. It is oftentimes, and we have a list, as I said before, that is now circulating on social media that we shared to the police, and there are 4 pages of lists with persons that came into this country with addresses and phone numbers that are circulating around the media freely, that we meant to send straight from our Port Health Department to the Trinidad and Tobago Police Service, and as of last night is circulating throughout the media. And that is to be used by the police service to call those persons, letting them know to stay home, and if they don't stay home, the full impact of the Quarantine Act will be put in place. So again, I don't know how it is out there, but again, is social media being mischievous and, yeah.
So back to the question, I'm sorry, Prime Minister.
Sure. So the Quarantine Act has there's a particular way to actually treat with it, which the police is fully aware of. I have their full support through ACP Williams and his team, and they are in the process actually now using the list that we sent to them. If people are found to be breaching their quarantine, the police will use the law, the full ambit of the law.
Mr. Aline?
Yeah. Sure.
One of the media houses today published the actual clauses of the Quarantine Act that's applicable. So I'll recommend that you advise yourself in that way. There is law that applies to this, and there is going to be more rigorous law enforcement. I think that's what Doc was saying. Let me just say something to the national community. The number of test kits that we are aiming to have available to us, if we use those test kits in Trinidad and Tobago, we will have tested at a level that is higher than most of the international community. One of the best examples of concentration of testing is South Korea. See how we compare with that, if we ever come to that situation. And of course, the way we have managed our affairs, the numbers and the projections and the modeling gave us a slightly better trajectory. But in terms of what's happening in Europe, what's happening in North America now, what we are literally looking at is on that level or better. And I also want to say that we're not alone in this world. We took steps to isolate ourselves so that what is happening outside will not flow into us. All the planning that we have done is to cater for who is in here. We can't plan for who is out there. But I just told you that we have 330,000 people out there who can call Trinidad and Tobago home. And if it is that circumstances become so dire out there, it is quite likely that some or significant numbers of those persons will head for home. And that is why when we close the border, if the border is to be closed, we couldn't have it open through another CARICOM port. Otherwise, we might as well open Piaco. We have 245,000 people in New York, in the United States, of which 165,000 are in New York. So when we understand that, we understand what could happen to us if the world's situation deteriorate in places where we have interests. We are not alone in this matter. We have almost 80,000 people in Canada who have that claim. And if we say, as we have said, that we've closed the border here, and there are people, especially government leaders, or national government leaders, I don't mean this government, I mean the leaders of the country. Some saying open window for bars, some saying open window for drinks and for chicken and so. Is that what we're doing? We might as well throw in the towel now. We're not going to do that. What we're doing is trying to deprive the virus of the ability to move from person to person. Understand that? And in so doing, we've made no one stateless. And such comments are not helpful. They are detrimental and undermining our best effort at home and abroad. Thank you all very much.